My name is Dr. Reddy, Vilash Reddy. I'm a child and adult psychiatrist, but I treat addiction. And I went to medical school and then went to a psychoanalytic adult psychiatry program in Ohio because I always had an interest in not like just learning about medications, but I was like, what is the person thinking about? Like, I think of medicines as a tool to fix like a problem in the brain, like a chemical imbalance, but the source is usually like in psychology, deeper and farther. So whenever I saw so in my program, it was actually it was funny because I could not prescribe medicines for 2 days out of five. So I would have to sit there and keep in mind, I didn't really know how to be a therapist. So I would listen, but I had a supervisor above me and she would record me all the time. And she's like, "Why are you scribbling when you're listening?" And because I try to be a good listener. And so I was like trying to pretend to be a therapist, meaning like writing notes, but I actually was remembering the entire thing. So what I learned was I was seeing a lot of adults and I was like hearing this constant theme. Could be a 54-year-old, could be 28-year-old, could be, whatever age. And a lot of it came down to childhood. And I was like, huh. So what I learned was that the older the person was that got treatment, just in therapy, it was harder to correct just in the psychology the issue, right? Like could be adjustment in school, but let's say I saw a woman that was 65 and went through so much trauma. I had to ask my supervisor at that point, like, can I give her medicine? Because it's almost like her brain was malfunctioning to a level that therapy was not going anywhere. So that's actually why I always say like people should be on medicines or a treatment that allow that therapy to be beneficial. An example would be in trauma. If you go to a trauma therapist and you're just talking about your trauma and all these things that have happened, you're actually going to do really bad because the number one thing is avoidance. And this is actually why I specialize in trauma, is most people avoid trauma, but the most common thing across the world. Like everybody's been through trauma, neglect, abuse. So what I learned was that most people that go to a therapist, in my opinion, they have to have some level of correction in the chemical of their brain. So as you're, let's say, stressed out and you're predisposed to depression or anxiety, your serotonin isn't effective and it starts like acting erratic. So our medications, they don't give you serotonin, they just correct the problem. So our brain can go back into feeling not as depressed because let's say you're completely depressed, how are you going to go to a therapist? Like how are you going to like sleep well? And that's the one argument I always made is therapists can't correct the chemicals that make you sleep. So so I always think that, therapy is actually very important because it helps like you have a foundation with medicines, but it helps you to repair some of these issues that are deeper. Like if my mom left me and I feel abandonment, how does it correct, how could a medication correct that feeling? So that's why I did the child fellowship at Washington University St. Louis because only 10% of psychiatrists are child psychiatrists because that's actually where one of the problems is that if you don't really understand the root of the tree and you're trimming branches, well, how good would you be at figuring out what the really underlying problem is? And so I always really, whenever I see adults, I start with their childhood. But most solely adult psychiatrists will start with, what are your symptoms? And they don't really ask you about your childhood, your family, your upbringing. So it's almost like let's like and those are the things that I think like shape that tree of existence, I guess. Um, and I think that's one of the biggest problems for adults in terms of misdiagnosis is just asking symptoms, here and there, and the person can interpret what they want. So you get misdiagnosed often because the person has, I've seen it so often, adult psychiatrists won't know what adult ADHD is because they'll see someone talking and, talking faster, and they'll say, oh, you have signs of rapid speech, and different because, so yeah, I think, I don't know if to answer the question or if I, I knew I would because I was like, I'll just lay it out there. Um, so social factors, meaning like family, job, all those things. Um, Actually, they're humongous, right? So that's kind of like why I think of things as holistic is like imagine if you're in a toxic family and you hate your job and your boss is so there's no way to compartmentalize your life and say I'll take a medicine and my life will be happy because and I think that's the illusion that most people have when they see a psychiatrist is they don't want to fix their issues, they want a pill to completely evaporate the problem, and I don't agree at all because if you think about it, as you are growing up, your parents are a huge factor in how they teach you how to live life and how you derive self-esteem and confidence and how they teach you how to not be so hard on yourself or so that they're kind of the beacon of regulating your own emotions. So if your parents are like all over the place, you are a blank slate as a kid. I mean, that's the best way to put it. So you're highly susceptible to any social factor. Like a kid bullying you at school can change the direction of your academics. So it's not that you're not bright, it's that why do I care? Because like this is a horrible experience. And so I think I think of that actually as a big factor that's also relating to where adult psychiatry do not pay attention is, well, if your mom was involved in your life, a social factor, would it change a lot of you? Y- Yes, because then you feel deficient compared to your other friends that you're seeing with the mom, right? Because we're comparative human beings, especially as kids. And so that's why I think having a foundation would include like an environmental factor tailored to how you think, right? Because let's say you have a teacher that is punitive against kids with ADHD or autism, that's going to lead to shame, which that high achieving ADHD student won't try because of one teacher. And or you take a teacher that is very, very attuned to ADHD, and they know the kid is very bright, but there's limitations. Like it's almost like we don't think of mental health as physical ailments. So if the kid had, you know, a deficiency in their muscle for their leg, the let's say the teacher said, "Oh, run like other kids," and ask, "Why aren't you running as fast?" Like it would be like the teacher would be fired, right? Um, but in the sense of, let's say if a teacher's like, "Why don't you try your best and don't worry about the other kids? Like you have this thing you're working on." That those words actually matter because the kid's gonna learn it's okay to kind of go at my pace and and they don't live in shame because they can't control it. Just like ADHD or autism, they're not they're trying to daydream. And so those are factors that are so relating to like environment and social factors. Mental health diseases are seen as character flaws, right? So if you're depressed, you're weak. If you have ADHD, you can't control your brain. If you have autism, there's something wrong with why you don't understand social skills. And there's truth in all that, but they're not trying to do that. It's just a part of their brain. And that's actually why I always tell parents, like, hey, think logic. Why would you go to class and run around and get in trouble every day? Hmm. Right. So that's actually why, like, a lot of people. So the whole theory is that people with autism, ADHD, they're more prone to. So those are hardware issues, right? Like the way their neurological system is set up. But because there's statistics showing that people with ADHD get 20,000 complaints by the age of 14. Now, how would your self-esteem be in comparison to another person if you get 20,000 complaints for something you don't even understand? Like these rules of life don't really make sense. Um, but you're highlighted. That's the thing. So there's other kids that do a bunch of other things, but because you've been labeled ADHD or autistic, that you're the troublemaker. But most kids do a lot of similar behaviors.